Hi, my name is Leanna Farmer, and I'm going to be doing my presentation on post-traumatic stress disorder, known as PTSD. What is PTSD? Post-traumatic stress disorder is a mental and behavior disorder that develops from experiencing a traumatic event such as a sexual assault, warfare, traffic collisions, child abuse, domestic violence, or other threats on a person's life or well-being. Symptoms of PTSD are reliving, flashbacks, hallucinations, nightmares of the incident, avoiding people, place, things, or memories that remind the trauma, excessive arousal, increased alertness, anger, fits of rage, irritability, or hatred, difficulty sleeping or concentrating, intrusive, negative, distressed thoughts or feelings such as guilt, flat effect. Young children may show in toilet training, motor skills, or other language. Cause of PTSD. The exact cause is not known. Traumatic event in life, such as sexual or physical assault, death of a loved one, an accident, war, or a natural disaster. Serious medical conditions. The risk factors of PTSD. Family history of depression and anxiety, having experienced traumatic events such as a childhood abuse, having previously diagnosed with depression or anxiety, substance abuse such as excessive drinking and drug use. Complications of PTSD affect normal functioning, problems in social and work relationships, depression, drug and alcohol abuse, eating disorders, and suicidal tendencies in severe cases. Prevention for PTSD. Be open about your condition and share your experience with your family and friends. Spend time with family and friends. Eat a healthy diet. Take plenty of rest. Exercise regularly. Learn and practice stress management exercises. Avoid caffeine and tobacco use. Avoid alcohol and drug use. Get involved in hobbies to reduce stress and anxiety. Treatments for PTSD. Medication would be antidepressants, cognitive behavior therapy, changing the thought process, exposure therapy, reliving the traumatic incident, psychodynamic therapy, handling personal values and emotional conflicts. And here are the references. I've learned a lot about PTSD that I did not know. A lot of people have PTSD because of war, and I knew that, but I didn't know that children can have PTSD and the symptoms that they would have when they get PTSD. So I did learn a lot in my research about PTSD.